There are a lot of topics that we don't want to talk about, we don't want to deal with, and I'm not talking about political subjects, although one would imagine at the state of things in Pakistan that nothing political is ever dealt with, it's just swept under a carpet. But there are serious issues that crop up in everyday life, things that we should be talking about, we should be dealing with, because it could at any time affect any one of us. So today we're going to do just that. We're going to talk about something that most people try to ignore, and that is mental health and the state of mental health in Pakistan. In that, how do we deal with it? What are we doing for people who are suffering from mental health problems? And are we equipped at home to deal with that? With me today in the studio are Dr. Veronica Carey and Dr. Granger, both of whom have come from the United States to Pakistan to work on a program called the Recovery House. Is that right?
That is correct.
So what made you come to Pakistan? How did you hear about this program, and why have you come here? Sorry if I got something wrong.
No, I'd like to answer that question. We are here because of the persistence of Ms. Shaheen Sultanam.
Okay.
She is the one who has had the vision for the Recovery House and to bring us here to provide support and education and training, not only for the staff at Recovery House, but the trustees and the families and the program participants themselves.
But how did she get in touch with you?
Back in the States, there's an opportunity called the Psychiatric Rehabilitation Association. As a part of that association, there's an international committee. So on the international committee, Shaheen is a part of that committee, and so am I.
Okay.
So therefore, we had an opportunity to meet and to dialogue about what is going on in Karachi and how the Psychiatric Rehabilitation Association can be of support.
So what is going on in Karachi?
What is happening in Karachi is actually very exciting. The opportunity to implement a new service is huge. There's an opportunity to talk about in terms of, we already have a functional mental health system, of course, here in Karachi. The psychiatric rehabilitation adds to that functional community. So it's a chance to offer a brand new dynamic to a current system.
Now when you say it's functional, how functional? In what way functional?
Currently, the Karachi is a clinical treatment type of a system, so that they're looking at meeting the needs and minimizing the stress and discomfort due to positive symptoms of mental illness, and are doing so effectively.
Really?
However, rehabilitation is something that the Recovery House seeks to augment that existing system.
Okay, so what exactly is mental illness? I mean, lots of people have different ideas as to what mental illness is.
Right.
And I know that depression, for example, is a huge factor, and there's so many millions of people, even in this city, suffering from depression.
Right.
There are different, I would have to say, different spectrums of mental health disorders. There are, in terms of, there's maybe schizophrenia, and that might be a more familiar one that people think that they know a lot about. Even within schizophrenia, there are positive symptoms and there's what's called negative symptoms. And what most lay persons are familiar with are most of the positive symptoms of schizophrenia.
Right.
So they might see someone that has hallucinations, or they might have delusions, or they might have disorganized speech or disorganized behavior. They may have some what we call negative symptoms. They may choose to isolate. They may not want to care for themselves as much as they did prior to being diagnosed with schizophrenia. But these are all things that are manageable. We are referring to individuals now as persons living with a mental health diagnosis, not living in the absence of life. They're actually enjoying life.
Right. Okay, there were two things. One was one you said clinical, the other is rehabilitation, and I know both of you are involved in the rehabilitation side. But have you come across more than one facility? I know the Recovery House is one, but are there any other facilities that you've come across in Pakistan as part of this program that you're here to do? Have you looked at other things as well?
Our focus on this visit
Right.
has been with the Recovery House.
And when you say with the Recovery House, what does that entail? What happens? You go through a clinical kind of process, and then if you're a patient, you go through the whole clinical process, and then you come here to recover in what way? I mean, how long are patients there for generally? Do they go home to their families? Do you train the families? Do you teach them how to care for the patient?
Well, I can tell you what we've learned, because when we came here, all we knew was a brochure.
Right.
And Shaheen's enthusiasm.
Right.
You must see what we're doing and come help us.
Right.
So what I've learned is the answer is yes to many of your questions. There's support for transitioning people from their clinical medications and supports to come back to the community, back to their families, to come to the recovery house, to learn more about how to get on with their life, how to manage their illness symptoms, how to work on that board, for them to understand how to take care of myself. Just as with diabetes, the nursing staff at your clinic will say, we want you to test your sugar, we want you to do this, we want you to, you learn how to do it yourself. Maybe you'll have a family member help you to remember things, but you learn how to do it yourself. Well, that's one of the things that is part of rehabilitation, is learning how to do for yourself.
That's really interesting.
But not just about medication.
Right. It's about everything, the whole sort of...
Then it's like, how do I want to engage my life back again with my family? Do I want to think about, I always wanted to write poetry. Oh, how did we... Let's learn how to write poetry. I know how to write poetry, I just want to do it. And I want to show this other person over here that I happen to have as my roommate in the residential part, we can do poetry together, and we'll read it to you after dinner.
Wow. So have you come across some poetry?
Actually, I have learned about it.
Yeah.
I haven't had a chance to read it.
Is it dark, or is it not to Sylvia Plath?
It's usually very uplifting. It talks about dreams, and it talks about aspirations, things that we would talk about, those treasures that we find in our life. Often persons who utilize the mental health system feel as if there's an absence of the availability of the same treasures that we have in our life. And we want to impart to staff and to participants of the rehabilitation process that those treasures are always available to you. So if someone were to say to me, what are the 3 important treasures to you, Dr. Carey? I would certainly say my family, my friends, and my laptop.
Oh God.
So those are 3 very important things in my life.
We're all trying to shed.
Exactly. I could have said my cell phone. But those are all things that are very important to me. So that if I were to speak to someone who's utilizing the recovery house and I say to them, what are 3 things that are very valuable to you? Family and friends is more universally going to come up. And that 3rd thing could be a pet, or it could be poetry, or it could be photography or art. So the recovery house is an opportunity for people to develop skills, develop resources and supports. The same way that we sustain ourselves in the community is how we have participants of the program sustain themselves in the community.
So a place like the recovery house, I mean, do they also provide therapy to the families? Apart from training and stuff?
That's an excellent question. There is a model within rehabilitation called psychoeducation. And what it literally means is being more aware of something, having more information than I had before. So family members have an opportunity to learn about what is mental illness. How does it affect my loved one? When I see an individual of my family maybe having a delusional moment, maybe talking to themselves or having hallucinations, what can I look for? There's something called a prodromal symptom. That means I can see it arriving, I can see it coming. And if family members know what those symptoms are, they can therefore get their loved one into a service that much sooner, so there's not a full-blown psychotic episode.
Right.
And so those are very, very important features.
Because a lot of the times you hear about episodes where people turn violent and then they have to be restrained.
Another myth that we can dispel today.
Well, how do you dispel that?
Absolutely. Actually, persons who utilize the mental health system are more aptly to be victims of crime than committing crimes, because they tend to be gullible. They tend to not maybe be aware of their surroundings. They might be mugged or something such as that. If an individual is violent or has a violent episode, the word episode in and of itself means it's not the norm.
It's just something that's happened because of
there could have been something
that's triggered it.
Exactly,
right?
exactly.
Right. So how would that kind of an episode be treated?
Well, therefore, if someone has a situational episode, so for example, if I'm next to Barbara and something just irritates me and I might hit at her or slap at her, that's a situational episode. That can be dealt with rehabilitatively. We can talk about there's other avenues to express what is happening with you than to attack someone else.
And I might get really upset. You know, if she hits me, I might get really upset and not know what to do and overreact myself.
And flustered.
But
flustered,
in the
yeah.
family psychoeducation, you learn what the meaning of that is. It's not necessarily directed at you. It
Right.
is part of an expression of the illness, and to know more how to care for the person so that they feel safe, and then you can get the help that they might need to know that.
So tell me something, do you find that it's difficult to get through to, say, the family sometimes, because you have to explain to them it's not about you, it's about the patient?
As part of the interviews that I've been conducting with the recovery house staff, I've asked them just that kind of question: how are you? How is it with the families? And of course, it's different with every individual. Each person has their own story. Each person may have no family here. There's one person whose family is all in the United States. So this means a totally different approach. But the story that that was told about this one person, which I thought was very exciting. So this person didn't happen to know how to use the computer, but was lured into being interested in the computer because he could email his mother in the United States.
Okay.
So he learned the new skill. But if they had gone into his room, come on, we're going to go learn how to use the computer. No, 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 no.
You had to be
You get them,
motivated.
you get them
Exactly.
through their heart and through their emotions. It's like, wouldn't you like to send your mother a letter through the computer? Here. And he came right into that room. So it started out with learning how to write a letter, and he realized he could use the computer, and from that, his skills built further and further.
Right.
And what-
So it connected the family, and it did rehabilitation of bringing this person new skills and realizing I'm much more than my mental illness.
And
So
one of the things
with-
one of the things that Barbara's also raising, that the recovery house staff are actually learning and doing, is that whole language piece. So when an individual is in rehabilitation, they're not a patient. They're a client, or they're a consumer, or they're a member. So there's a very huge distinction there. And then also within them being a client, consumer, or member, they're also looking at, who else am I? Who else is this individual? There's a saying that the mental health diagnosis made them eligible to meet you because we're in a behavioral health system. But who else are they? So this individual is a son. This individual is a brother. He may be an uncle or a grandfather. So he could have worked for several years. He may be working currently. So what other hats does this individual wear that we should be aware of? So when we engage people, it's not about the diagnosis. That's what made
It's
them
about the
eligible
person.
to be present. Exactly. So who else is this individual? Who else is this person?
How do the patients react to that when you know,
who?
the patient, the client, the member of the club, the
Right,
client,
right,
you know,
they actually appreciate it, because if there is an opportunity that's new and engaging, and the staff at the recovery house have the energy and the enthusiasm and the excitement, that you're intrigued. And then when individuals walk over to you as a staff and they say, what are some of the things you always wanted to do? Here's an opportunity to do them here. People tend to share what those interests are.
What does it do for their self-esteem, Barbara?
Oh, every time they do an accomplishment, the tiniest accomplishment, to encourage that accomplishment, to praise and celebrate that accomplishment, absolutely, it's just not just boosting their self-esteem, it's reminding them that they are a growing, learning human being who other people can appreciate.
And you know, like, how do your clients, you know, do they sort of come back with feedback and comment, and do they tell you, you know, I feel good today, I like what's happening, I feel better about myself.
Absolutely.
I think my family understands me better.
And I was going to say, and they report that to their family members.
Really?
So now family feels more encouraged to continue with the process. Family feels as if, you know, they see a significant change in their loved one, because this might have been someone who has depression, that might have maybe isolated themselves. Now they're engaged. Now they're in computer unit. Now they're in music unit. We had an opportunity at the recovery house to witness sound therapy. And what that does, and just feeling that innate, the drums and the violin and all the different members and clients were playing these different instruments.
It was a concert.
It was a concert. Wow. And we were invited to this concert as being the Americans are coming. And the
Americans are coming.
Yes,
the Americans are coming.
and they wanted to put this concert on for us. I had asked, can I get up and dance? And they were just so thrilled that they were playing well enough that we could dance with them.
Wow, and we asked them to play more.
That's right.
Incredible.
It was exciting.
So it's all about changing the meme. We're going to take a short break here. We'll be back in a moment. Stay with us.